From VOA Learning English, welcome to the Health Report in Special English. The Gavi Alliance is a partnership between public health officials and private industry. The group provides vaccines to developing countries. Recently, the Alliance announced plans for an immunization campaign to protect 180,000 girls from cervical cancer. It has chosen 8 countries to start administering the vaccine for human papillomavirus, or HPV. Most cervical cancers result from HPV. The virus is passed through sex. Seth Berkley is Chief Executive Officer of the Gavi Alliance. He says 1 woman dies every 2 minutes from cervical cancer. That is more women than die in childbirth. Dr. Berkley says an estimated 275,000 women die from this cancer each year, and 85% of the victims are in the developing world. He warns that without intervention, the estimate would reach 430,000 deaths a year by 2030. The HPV vaccine is given to girls between the ages of 9 and 13. It is only effective before someone is infected with the virus. If infection does take place, the virus may cause extremely small changes at the cellular level. A pap smear test or pap test can find those changes, but the test may not be available to women in developing countries. If the infection is not found, the cancer begins to grow and will spread. There are signs like bleeding, and after the cancer spreads, there is pain. The HPV vaccine will be administered as part of school programs in Laos and 7 African countries. The 7 are Ghana, Kenya, Madagascar, Malawi, Niger, Sierra Leone, and Tanzania. Dr. Berkley notes that efforts must be made to reach girls who are not in school. For VOA Learning English, I'm Alex Villarreal. This is the VOA Special English Health Report. Heart disease is the world's leading cause of death, yet most cases can be prevented. Doctors say reducing deaths from heart disease will require not only changes in the way people live, it will also require changes in public policy and better public knowledge about differences in heart disease between men and women. 2 conditions, coronary artery disease and microvascular disease, can both reduce blood flow to the heart. Experts at Brigham and Women's Hospital in Boston say heart disease in women is more likely to be caused by microvascular disease. Finding this condition may require tests other than an angiogram. An angiogram is a kind of X-ray test. Doctors use it to look for a buildup of fatty plaque material that can block arteries. Arteries carry oxygen-rich blood away from the heart to the rest of the body. The World Health Organization says heart disease kills 18 million women a year. And these are not just older women. Carrie Vincent had a heart attack after giving birth to her first child at the age of 31. Ms. Vincent is now taking her message to women at meetings in their homes through an organization called Sister to Sister. Irene Paulin started Sister to Sister to educate women about heart disease. Ms. Paulin urges women to learn about their blood pressure cholesterol levels, and other risk factors for heart disease. Ms. Pollen teamed up with a heart specialist at Brigham and Women's Hospital. Dr. Joanne Foodie works mostly on prevention efforts. She says, "The good news is we know that 90% of heart disease is preventable by reducing risk. That means not smoking, and it means controlling or avoiding diabetes. It also means keeping a healthy weight and eating healthy foods. And it means exercising at least 30 minutes on most days and managing or reducing stress." Dr. Dariush Mozaffarian at the Harvard School of Public Health also has other advice. He says people should eat more fish, whole grains, vegetables, vegetable oils, and nuts, and reduce the amount of salt and trans fats in their diets. Trans fats can increase the risk of heart disease. Heart disease increasingly affects women in developing countries. Dr. Mozaffarian places a lot of blame on the global epidemic of obesity. He says people are getting chronic diseases not from eating too much, but eating poorly. And so, in fact, what they're not eating is actually probably mostly what's harming them. For VOA Special English, I'm Alex Villarreal.